So that is what this consultation step does for us. It guides us on the next step, and the next step is testing, evaluation. In this testing phase, we are looking at a full checkup. We are trying to see the entire internal milieu of you and your husband to understand what is going on here. Why are we having delays in getting pregnancy? What is causing the issues? We would prefer to identify a cause so that we can know that this is the cause. And it will interest you to know that when it comes to the cause of male and female infertility, we are looking at, the studies have also shown that it's equally proportioned. So you have about 30% of it coming from males, 30% of it coming from the females, and on that 30% that is a mixture of both a male and a female factor. But we now have another subgroup, which is 10% of them are said to come from unexplained infertility. So what do we call unexplained infertility? It means that for all practical purposes, by all evaluation and review that we have done, we cannot find an identifiable cause for this delay. And because we cannot find an identifiable cause at that point in time, maybe medicine has not gotten to the point of being able to understand what the cause is. Maybe the resources are not there to go that far. But it now means that we are going to approach you as unexplained infertility. We're not sure what the cause is, but we'll try and optimize everything that your body has so that we can see how best we can make things flow. So if you go to the hospital and your blood has been tested, hormones has been tested, fallopian tube scan, you've done hysteroscopy, semen analysis, AMH, whatever it may be, and you find out that there's no problem. It's not. It does not mean that that's the end. It does not mean that that's the end. That happens. It's interesting to know that as humans, we are not very fertile. We're not very fertile as humans, as a species. If you want to make a comparison of this, look at how the dogs, the rabbits, how they get pregnant. With ease, right? Very rapidly, rabbit is pumping out hundreds hundreds is an exaggeration, but you get the point. So they are pumping this out, and it's not so for humans. A fully healthy male in the best of health and a fully healthy female in the best of health could continually have intercourse up to 3 to 4 times a week without any form of protection, with proper ejaculation in that situation, and still have difficulty getting pregnant. They may not get pregnant within the first month. Ideally, if they are a young couple, they should get pregnant within a year. But that should give you some form of insight into the nature of the issues that are actually here. So that's one of the reasons why we do so many tests. And after the tests are done, the test will now lead us into the third step that you need to follow.
If you like this video and you want more information about fertility, IVF, babies, surrogacy, IUI, and many other fertility procedures as well as medical issues, kindly subscribe, share, and like this video for more.